In what is being called the longest strike in the 75-long-year history of the British state-run National Health Service, junior doctors in England are on a 6-day strike over pay hike. The strike is expected to hit patient care during a seasonal winter peak in demand.
From my first day of work, there was low staffing, the hospital was at critical capacity, there was corridor nursing. Me and my colleagues were expected to take up more senior decisions and work at a level where we're just getting burnt out, we're tired, we don't feel supported.
The British Medical Association comprises of around 50,000 junior doctors. The strikes have come after negotiations hit a halt after the government had offered a pay rise of anywhere from 8 to 10%. The doctors are demanding for a rise of almost 35%. Now, over the past year, junior doctors represented by the British Medical Association have staged a series of walkouts. The union has also urged the government to make a credible pay offer. The doctors are seeking better pay that is linked to soaring inflation. Cumulatively, the NHS has cancelled 1.2 million appointments since the strikes began in 2023. Despite agreeing to new pay deals with other healthcare workers, including nurses and senior doctors in recent months, the NHS has resisted hikes for the junior doctors, saying that will actually worsen inflation. And we earlier spoke with our correspondent Juliet Chapman, who joined us live from London, and this is what she had to say.
Well, so far they have been unable to. They have left the negotiating table, which is why junior doctors are taking to the picket line once again, and this time for much longer than they ever have before. The 6-day strike is historic in its length. It will certainly be disruptive to a number of services. When they went on strike in December for 3 days, there were 90,000 appointments that had to be delayed. This time it's likely to be more than twice that. And over the course of the last year, there have been a number of different strikes from different sectors of the healthcare service. We've seen nurses go on strike, ambulance drivers, paramedics, and senior doctors as well. But most of those have now been resolved. Senior doctors are still deciding whether to accept the government's latest pay offer, which for them would be a 5% increase on top of the 6% that they got last year. But junior doctors are not quite satisfied with what they have been offered so far. On average, these doctors, who have a range of salaries because they include doctors in their first year of practice to 9 years in, on average they were offered 8.8% last year. Then in negotiations towards the end of the year, they were offered a further 3%. But their union, the British Medical Association, is calling for 35% hike on average overall to undo some of the damage they say has been done over the past 15 years or so, when doctors have seen a real terms pay cut because of how high inflation is. Now, junior doctors make up a huge, almost half of the workforce when it comes to doctors in the National Health Service, so the disruptions are expected to be significant. We're seeing lots of appointments cancelled. Most emergency services are still open, but at least one hospital in the southwest of England has closed its emergency department and is diverting patients to a neighbouring hospital. So undoubtedly lots of disruption, but doctors, the NHS and the unions have an agreement in place that if the situation becomes extremely difficult in hospitals, then the striking junior doctors will leave the picket line and go back to their work.
WION is now available in your country. Download the app now and get all the news on the move.